Hello guys, so today's topic is central retinal arterial occlusion. So what is central retinal artery occlusion? If there is an occlusion in the central retinal artery, then it will lead to ischemia in the retina. This is known as central retinal artery occlusion. What is the retinal ischemia time? The retinal ischemia time is 97 minutes. The retinal ischemia time is 97 minutes. It is an ophthalmic emergency. It is an ophthalmic emergency. It is more common in males than in females, and the causes are two types mainly. First one is thrombosis, and the second is embolism. Thrombosis consists of 80% of the cases, and embolism consists of only 20% of the cases of central retinal artery occlusion. Now, the most common plaque which is seen in the central retinal arteriolar occlusion is Hollenhorst plaque. It is known as Hollenhorst plaques. This question has been asked. It is a very important question. Hollenhorst plaques. It is present in the arteriolar bifurcation area. What is the clinical feature of central retinal arteriolar occlusion? The clinical features are sudden, painless loss of vision. It is sudden, it is painless, and there is loss of vision, not diminution of vision. RAPD will be positive, and the retina will have an appearance of cherry red spot. Retina will have an appearance of cherry red spot. The maximum ischemic injury is seen in ganglionic cell layer. Now coming to the management part of the central retinal artery occlusion, the main part of the central management is to decrease the intraocular pressure. The main management is to decrease the intraocular pressure. So how will it decrease the intraocular pressure? There are many ways. First of all, in an emergency condition where you have no access to hospital, you will do ocular massage. This question has been asked in INICET. You will do ocular massage. Second is IV acetazolamide. Then IV mannitol can also be used. And then anterior chamber paracentesis. So ocular massage, acetazolamide, mannitol, and anterior chamber paracentesis. Most question has been asked from the ocular massage part, and it is also the first step in the management of central retinal arterial occlusion. Second, you can also give 95% oxygen plus 5% CO2, 95% oxygen plus 5% CO2 for its management. This actually causes vasodilation and it decreases the intraocular pressure. And lastly, thrombolysis can also be done by IV anticoagulants and IV steroids. In whole of this management part, only ocular massage part is important. Nothing else is asked in questions. What are the causes of cherry red spot? What are the DD of cherry red spot? The DD of cherry red spot is central retinal arterial occlusion, Tay-Sachs disease, Niemann-Pick disease, blunt trauma, or Berlin's edema, and Sandhoff's disease. In Gaucher's disease, cherry red spot is not seen. It is a very important question and it has been asked. in previous year. So this is a very important part. DT of cherry red spot, central retinal artery occlusion, Tay-Sachs disease, Niemann-Pick, Berlin trauma, blunt trauma or Berlin sediments, Handoff's disease. In Gaucher disease, it is not seen. Also in central retinal venous occlusion, it is not seen. Important. Now coming to CRVO, central retinous venous occlusion. The etiology is hypertension, diabetes mellitus, and atherosclerosis. So there is two variety of CRVO. The first variety is ischemic type and the second variety is non-ischemic type. In non-ischemic type, due to hypoxia or due to congestion due to CRVO, there are blood vessel formation, and since there are blood vessel formation, the disease remains mild to moderate. The disease is mild to moderate and you see diminution of vision and not loss of vision. Whereas in ischemic type, there is complete ischemia due to CRVO. So you see severe disease over here. Everything will be severe in it and there will be again diminution of vision, not loss of vision, unlike CRAO. The fundus in ischemic type, shows splashed tomato appearance. Splashed tomato appearance, which you can see over here. And what is the treatment of the ischemic type? The treatment of ischemic type is laser photocoagulation. And you also see neovascular glaucoma in it. Neovascular glaucoma, which is also known as 100-day glaucoma. So it is a very important thing. The 100-day glaucoma or the neovascular glaucoma is seen in ischemic variety. Okay, it is a very important question and a lot of question has been asked in previous year. Now coming to the non-ischemic variety. In the non-ischemic variety, the disease is mild to moderate. Already I have said the diminution of vision is present and the treatment is, since there are blood vessel formation, so intravitreal, not IV, intravitreal triamcinolone plus anti-VEGF agents.